I come here to see you because I have my low back problem and started like 15 years ago, and I believe that started when I was driving truck. I say that because that's when everything started to be a problem for me.
Gotcha.
And after that, I went through my leg, slowly down to the knee, and then went down to the feet, down the feet. Then when I get a worse pain here, like a big pain, it went like burning my leg and both sides.
Got it.
And then I went through so many, doctor splitting my back and some other kind of machine they has to open on space.
What, decompression?
Yeah, decompression, yes.
Gotcha.
Also chiropractic and everything else, and nothing helped. So I went to surgery, to the center to get surgery to open up my. They say the bone was close, the line of the, whatever the nerve going down, and they scratch off a nail. I don't know. They shave the bone, but this is not resolve my problem.
So let's clarify some stuff for you. So you mentioned that the pain was going down to your foot. What areas of the foot is still at that? What is it right now? That's painful. So what areas of the foot that's still painful? Are we talking about the pinky toe, middle toe, bigger toe, bottom of the foot? Where seems to be the problem?
The problem is the whole leg. Okay. I feel numb, like a burn pain.
Got it.
I cannot say like a dry pain. My pain is burn pain, which is very difficult to say, what is the pain.
Gotcha.
But I feel like burned on here.
Got it. On the outside.
Yeah.
Got it. Okay. So the reason why I want to know is because this region over here, depending on what areas of the foot you're experiencing that discomfort, has different spinal level nerves. So typically what you're presenting is approximately is that first sacral nerve region. Right? So we're going to take a closer look on your low back itself.
Okay. See
which one actual spinal nerve is being involved in this regard. And other things, just want to clarify. So you mentioned about what you talked about where they shave the bone in there. That's called a stenosis, right? So the foraminal openings where the nerve comes out got really small, and it sounds like the surgeons, they like open up, made it a little wider.
Yeah.
Right. And a little bit earlier, you mentioned to me before, being that you had one surgery before, and that was in 2014. And 3 months, still same problem. They did a needle EMG, found out that the nerves are still being compromised.
Yeah.
They did a second surgery. You noticed by how much percent got better in terms of the leg?
I believe it's like a 50%.
50%. And what about the pain in your low back? Did that change at all?
No.
Got it. Okay. So to clarify to the viewers, this particular type of condition what he's experiencing is called failed back surgery syndrome. So recent studies have shown conservative numbers is where it happens is anywhere between 20% as high as 48% of where the condition in terms of symptomatic discomfort is still present. So we're going to take a closer look, see what's going on either in his lumbar area or in the pelvic foundation, see what's going on causing all this discomfort.
It happened in between since my problem started. I went to a specialist doctor for that, and they say they cannot find it why, but they question why it's medication what I drinking from that time, and they say that might be the painkiller medication causing me some problem in my, I think it's something in the, in the whatchamacallit this, in the brains, that doesn't make no signal down to my lobe,
I got it.
part to make testosterone.
Got it. Okay, so when did that first started?
That started between all this process that I'm going through, because in the beginning I wasn't had that kind of situation. It just.
So roughly ballpark, how many years?
I believe it was like a 7 years later after
the injury?
Yes.
So 15 years ago was was this problem first started off, and then halfway point, then this new problem starts showing up.
Yeah.
Okay. So let's go ahead. Let's connect all the dots. Why this is a potential problem and how it's connected to everything else. You had some kind of low back pain in this region over here. You also had 2 surgeries right on that spot right there, and you feel this radiating pain all the way down to your foot, to the outside over here. Okay. Now, why did I ask about that? Decreased amount of testosterone. Well, you can see it right over here. This nerve over here controls all this. I get it. You understand that pain. But what a lot of people, they don't realize, that's not the primary purpose of all these nerves. It's not for pain sensation or moving the muscles. It has to run all these organs. This is the model of the lumbar spine over here. Now, as you see over this is the spinal nerve. You don't need a microscope. They're actually this big. They're huge, right? Because they need to operate all these organs over here. Now, in your case, I'm not saying it definitively is, because we need to order a very specialized test to determine that's the exact issue. And I don't know if too many technicians will allow, they're gonna actually test for that. So, the nerves involved is here. This is your testicles. This is where testosterone is being produced. Now, if there is some kind of neurological compromise from here, where is this connected to? Exactly, right?
Yeah.
So, this has been going on for 15 years. I would not be surprised that there's continual detrimental damage. Keeps on piling up until it eventually affects the nerves that's controlling your testicles, and not allowing this fellow to function as well as it should. So what this instrument we'll be doing right now is we're checking for any differences in temperature. Any abnormal heat reading indicates a possible potential problem at that particular level for us to take a closer look at. And this is what we already find right here. Right at the spot. We're marking at that level. Now when we take a look at the visual appearance, we can see the old surgery scar right over here and a node right over here. So we got some interesting laparoscopic incisions over here. But also what we see is a wide band of swelling right above here. And let's check that. That's 5, 4, third lumbar. So there's some kind of compensation that's happening at this third lumbar level area. We're going to take a closer look on the film, see what's going on biomechanically. So let's go ahead, let's take a look. Any differences here? Any tenderness, discomfort?
No.
Nothing. What about here?
It's no like that. It's two different things. You feel it different.
In what way?
This one is...
The left side feels like what?
Like you touching something in my bone. Right here, I feel like you touch me, but
it's
I
like
can't
what?
tell you. It's like a big bone, I would say.
So would you say what? Numbness or
numbness,
right?
Numbness.
So in other words, you don't have much sensation in here?
Yeah.
But how much less sensation would you say from here to here?
I would say maybe half.
50% less.
Yes.
Got it. Understood. So let's take a closer look, see what's going on here. So because that the patient was explaining that it's experiencing half the amount from here, so there's clearly some kind of nerve compromise somewhere around this region over here, following along the sciatic nerve, decreasing nerve function to that area. So let's go ahead, let's take a look, see what's going on in this pelvic foundation. You feel this over here? This is stuck. This is, on your left side, is not moving too well.
No.
You see your right side. This right side over here, it's moving fine. Your right hip is moving fine. Do you feel that over here? Your left side?
Yeah.
It's stuck. It's not moving too well. Let me move over here. I think this is a better idea. And let's take a look at your fifth lumbar. How's this fellow over here? What does that feel like?
I just feel like you push.
Okay. This over here is kind of stuck. And it just did a little, it just moved just a tiny bit already, just for this alone. You see over here, when we rotate you this way, it's not moving at all. This is stuck this way. And you can move freely on this side. So your jam is stuck that way as well. Alright, so that gives an idea. This is an area, we're going to take a closer look on the film. What was on here? I want to check a look. One on the lumbars. This third lumbar is stuck as well, but not as bad. When I see your biomechanics of your spine itself over here, we got two potential issues. The foundation itself, and also this fifth lumbar. Now, we have to triage this fella. Now, the reason why I say her sacrum is a bit has an issue is because when I took a look at the sideways over here, this should be one bone. When we're first born, it's actually in 5 pieces. And when we get to our mid-30s, that's when it finally fuses as one piece. I don't want to see any residual discs in there. However, we do see one in your case. It's between the first and second one over here, and it's gapped open like this. Open on the back. This one over here. So it's open, since it's open up this way, that tells us this one over here, second sacral segment, that's misaligned. And when I checked on you, right at that level, the ones above it and the one below it kind of moves decently, it's still kind of stuck. But number 2 is even more stuck. So that's one potential one we need to address in the future. But what I also check on you, your fifth lumbar also is not moving too well either. What I see on here, the lateral, this is supposed to be normal, proper alignment. And when it does so, see this over here? See how much it moves? This is normal. However, when it gets knocked out of alignment backwards like this, you see how unstable this is? There's too much movement. So when it moves too much like this, your body engages 2 defense mechanisms. Number 1, the surrounding postural muscles, they clench up. So that can help explain why you feel all that muscle tightness in the back.
Yeah, it is tight.
Right?
Yeah.
Second component. What else it does? It swells up. So when it swells up in that whole entire area, it acts like an airbag to help stabilize this joint. The trade-off, all that swelling, pinches that nerve. So to clarify, we're not talking about bone that's actually pinching on a nerve. That's extremely rare. It does happen, but we're talking about approximately 1% of the time. Very uncommon. It has to be this bad, this severely degenerated. We're to the point that yes, you don't have this nice little tunnel over here. It doesn't have this nice little space anymore. This tunnel completely collapsed to the point that now, yes, the bone really is pinching the nerve itself. We don't want to get into this position. You don't have this, by the way.
Okay.
Why? Because I see some space over here. Now, the way it's presenting itself over here tells us this fifth lumbar bone is severely rotated, meaning, yeah, you're really kind of twisted up to the point that, like this, right? Now, because of this rotation over here, it's giving that false impression as if there's not much rotation, even though there's quite a bit. And we checked it on you during the examination itself. So, that fifth lumbar, and that's what it shows on here, the lateral, it went backwards and slightly tilted backwards as well. Now, because the surgeon went in there and they did some form of laminectomy, I can't tell exactly what they did to it because we don't have MRIs right now. Because that what tells us the condition, the biomechanics of what's going on with this disc itself. What I can say is right now, during examination, as we noticed, you didn't exactly elicit a lot of pain, which is very unusual for a person in your kind of position, especially with that burning sensation down your legs. When I challenge it, any other person was like, you know, it hurts, you know?
Yeah.
But in your case, you know, I feel something there, right? So that tells us either A, the nerve is heavily compromised, or B, all that pain medication you're taking, it's very intense. It's very strong stuff to really, you know, turn off the nerve, the pain sensation at that level.
Yeah.
So, the examination already told us that fifth lumbar, this is the one we need to correct. On a following visit, when it's ready, we're going to correct this foundation as well. Show me which one's like uncomfortable for you.
Right here.
Going that way? What about going the other way?
The other way?
Not much. Only when you're going to your left side,
Yeah.
it causes a problem.
Yeah.
Be very gentle with that fella. And the reason why we're going to be very gentle for it, because again, we had those 2 surgeries in this place.
Yeah.
So we're going to be conservative with this fellow over here.
Yeah.
Do me a favor. Head this way, please. Roll you over. Don't worry, you're not gonna fall. Right over here. Come on up. Right, walk around. What's different?
I don't know.
Oh, you're close in.
Yeah.
What kind of changes are you noticing right now?
No, it's just. Yeah, it's when pain cool out.
The pain what?
Cool out.
Cool down?
Cool.
What about the leg? You mentioned there's burning sensation going all the way down.
It went out.
How's it now? How's it now?
It went out.
It went out?
Yeah.
Do you feel any burning sensation there now?
No. No. Just.
So how much is left?
I would say nothing.
Nothing?
No.
Okay. What about the back? Anything there?
The back, just where the surgery is, that's where the little pains, and I know.
Got it. Why don't you have a seat? You said leaning over caused some discomfort. Okay, so go ahead.
It's fine.
How's that now?
No.
No what?
No pain.
No pain, huh?
No.
So how do you like that? Pretty wild, ain't it?
I don't know.
What do you think? Ain't that something?
You did something.
Well, I know I did something.
Yeah.
This is what I want you to do when you get home. Remember as before, pineapple or papaya, one or the other, 1/4 of it, try to eat it 3 times a day. It needs to be fresh, not canned.
Yeah.
And when you do that, stretch. Right?
Okay.
But you have to wait 30 minutes. That's enough time for your body to absorb the paralytic enzymes into your blood so it can circulate, go into that area, your low back. So you can stretch going backwards, forwards, side to side. Very slowly. Don't go ballistic. Don't go like rapid, quick.
Yeah.
No. Very gentle, slow stretch like this. Leaning forwards, rotations, so on and so forth. Very carefully, very slowly. Again, your body's going to be slowly repairing that area, right? So as you start healing and repairing it, it's going to be a little raw, a little bit gentle. You may re-injure it. That's what we're going to be careful of.
Okay.
All right. Any other questions?
That's it.
All right. We're all set, brother. No, you're welcome.
Okay, man.